Everyone in healthcare has a story that they never forget. Some are beautiful, some are difficult, and most are never told. This is the space where doctors talk about the moments that change them. Welcome to HUMED, where we talk about the emotional, moral, and human realities of medicine. I'm Dr. David Spiro. Thank you for being here. And I am incredibly delighted and honored to have Hillary Mayberry with us today. Hillary is a colleague of mine. She's on faculty at the University of Arkansas for Medical Sciences or UAMS, and she is an assistant professor and a leader at the physician assistant program at UAMS. And she hails from Amel, Arkansas, which is not far from Little Rock. It's kind of right over the river, as the crow speaks, and attended PA school at UAMS. So you must have gotten good grades to be asked to stay on faculty. And welcome to the HUMED podcast.
Awesome. Thank you so much for having me. I'm so excited to be here today.
Great. And you are our first physician assistant guest. We've had two APRNs to my recollection, and I just interviewed a wonderful occupational therapist. So we're really delving into all the different kinds of providers. And I would love for you to share a little bit about what story you'd like to share with us today.
Awesome. Well, yeah, I feel very special to be the first PA on the podcast. Hopefully many more to come. So I struggled a little bit to think about what exact story I wanted to pick for this. I thought of my clinical experience. I worked in plastic and reconstructive surgery for about 6 years, and just recently stepped away from part-time work there. And then also have been in academia now for almost 5 years. And so I was kind of thinking clinical setting versus academic setting, but I just kept coming back to an experience I had with a student when I started early on in academia that really it changed the way that I approach conversations with people, particularly when I'm in some sort of a mentorship or coaching type role. And I just thought this is really translatable to working as a clinician, but also just even in personal life relating with people and how to approach trying to help somebody who's struggling through something. And so this particular student, it was very, very early on in my time in academia. She was struggling academically and had come to see me for exam remediation. And if I'm being honest, I was really kind of struggling a little bit with coaching students through academic challenges. I did do okay in school, and I didn't have to struggle too much academically, which obviously was wonderful. But it was kind of creating a little bit of a gap between myself and trying to coach students who were struggling. So I was navigating this and trying to figure that out myself. And so as I'm meeting with this student, she is kind of explaining, what she's done to prepare for this exam. And it would have been really easy for me to make assumptions about what could be going on. She's not studying enough. She's disengaged, or maybe doesn't care. Maybe she's overwhelmed, or even not cut out for this. Um, and so I honestly had to push back a little bit of an urge that I often get, and many people probably can relate, to fix it and jump right in with solutions, and give strategies and tell her to, tighten up structure here and there, and prescribe my treatment plan for her, if you will. But instead of making assumptions, I kind of had this feeling of, okay, I need to be humble in this situation and figure out what's going on here and ask more questions, just because though I consider myself somewhat of a empathic person, I am struggling to figure out, how to meet her where she's at. And so instead of asking, leading questions or corrective questions, I just got very curious about what was going on. And so asking just even things, what happens for you during exams? And she kind of described, her mind kind of going blank, her heart's racing, and feeling like she can't retrieve this information that she felt very confident going into the exam with. As I listen to her, I'm realizing I don't know that we have someone who is struggling to understand concepts. Maybe she's struggling to access that information under pressure. And so I kept asking questions. Is this new? Does this happen in other settings? What does it feel like, in your body when this is happening? And I'm just, as I'm hearing this, I'm like, this sounds more like performance anxiety to me, really than her truly not knowing the information. And so we have very specific regulations on not functioning as medical providers for our students. And so, of course, I was not going to make a true diagnosis for her or anything, but I did advise that she go meet with her medical provider and potentially look at getting academic accommodations to see if that could improve this. And so she did do that, and she was able to get a formal diagnosis, get accommodations. And what we saw was very quickly after those were implemented, she started to kind of take off academically.
Mm,
And so it was incredible because she got some extra time to manage this, but the extra time didn't make her any smarter. It just helped her to access the knowledge she already had without this additional pressure that was kind of crippling her. So her scores improved, and we had a student who was very, very much struggling and potentially even at risk for dismissal, who continued to grow and improve throughout the program, and is a practicing provider today and did
mm,
fantastic. And so that experience really changed how I approach entering these conversations with people, in terms of not making assumptions about what could be going on. That's really hard for us at times. It can be really easy to fill in the gaps, fill in the blanks, so to speak, on our own. And so I think that having that humility to approach the conversation was something that I learned from that. I started looking into coaching models and how to grow in this, knowing that it was going to be something that I would continue to do in the academic setting. And I actually came across a mnemonic in this, which was really helpful. And it's GROW, GROW, and that stands for goal, reflective listening, options, and the W is way forward. And so that starts with the G being having this shared goal, which means we have to first understand what is their goal. And I think that can be critical when it comes to working with patients too, because we often come in with our own agenda and here's the treatment plan and jump, straight to it. But instead of assuming we've got, a patient who isn't adherent because they don't care, and assuming that they're non-compliant or not motivated, maybe instead asking, well, what matters most to you right now? What feels hardest about this plan, or what options seem realistic for you? So I think really starting with that goal and knowing what theirs is in that conversation is pretty critical.
yeah, it's interesting because, let's call it under the umbrella of, mental health issues. Uh, it happens everywhere. Many of us, I've gone through therapy before, when I've had difficult life things happen, when my dad died, and, mental health stuff is all around us. And I think when I was growing up in the late '60s and early '70s, it was taboo. And, I think that, there is still something that exists now that is a sense of shame, or I don't weakness. I don't know, Hillary, what do you think it is? But I still think there's something there when you're a student that's I what is that I'm trying to tap into? What do you think that is?
Well, I think there definitely still is some social stigma
Mhm.
about it that can make that very challenging. I think especially in this particular student, you know, all anyone knows is their own experience, right?
Mm.
And so for her, she didn't know that that's not what everybody else is experiencing when they go in to take an exam. And of course, there's different levels of anxiety, and everybody has, you know, some nerves. But in that conversation, her realizing, oh, so this could be considered a disability, and I could get a formal accommodation for it. There was, you know, not understanding of that, and so that helped us with students have conversations of how can we explain this more clearly, to make sure we're meeting people where they're at. I think that, you know, not understanding that what could actually be pathologic or abnormal, is a piece of it, and then certainly the stigma that we still battle against today to um, to normalize it, if you will, and make it okay to talk about.
In pediatrics, and I'm a pediatrician and then a pediatric ear physician, we've learned that, there are obviously 2 forms of attention issues. One is with hyperactivity and one is without it, or ADHD or ADD, attention deficit disorder, and there are, pretty well known it's pretty well known now that women or girls sometimes get diagnosed later because they are more likely to have ADD versus ADHD. So in kindergarten, when Johnny is running around and disrupting everything and knocking down blocks and doing whatever kids with ADHD do, it's like Johnny is struggling, right? Whereas with girls, and my understanding with adult women as well, sometimes ADD is a little bit more difficult to diagnose because there's compensations sometimes for it. And I'm curious in the current, because I'm a professor as well. I teach, but I'm more on the clinical side, and you're still engaged in classroom and watching the students go from very little knowledge to graduating PA school. What what has been your sense of attention issues and, accommodations for that? And, have you picked up on that as well, or can you pick up on it as a teacher in the classroom or in the clinical years?
I will say, in the short time that I've been in academia, we have had an increase in, the number of accommodations needed, and so it is interesting as we're having these conversations more, maybe some of those things are being looked into, a little more fully. I will say also that I just in anecdotally, the conversations I've had, there have been several females who have said that they've had late diagnoses.
Hmm.
And so I can see how that would certainly be the case, with the ADD component for females for sure.
Yeah, because you had said you would come into it saying you had a plan, and, no one in academia likes to be on the end of trying to help. Well, we're all trying to help students on some level, but when a student is struggling, sometimes we have these preformed ideas about what it is, and it really isn't that. There could be they could be having marital issues or issues with their child at home, and we just don't know until you actually ask and find out. When you, are involved in it's very difficult to get into the UAMS PA school. I know that you all have a very competitive process to get in, and my understanding nationally, that has been the trend, that there have been more and more people applying to PA school, versus spots open. What do you actually screen for folks or screen out folks with mental health issues when you're, looking at students? Is that verboten? Is it forbidden to sort of even ask about it? Is it incorporated into the admission process, or should it be?
It is not, as far as I know. I am a little bit removed from our admissions process in some ways. I do contribute with our interviews and some of the pre-review, but that's not something that we ask for students to disclose. We do have some questions about them being able to discuss challenges they've overcome in their life just in a general sense. And so occasionally there will be some vulnerability that's expressed in that. Um, but I think we have to be really careful too with trying to screen in that sense as well. In terms of an admissions point, in terms of supporting them through that, I think we have to be very clear about what the opportunities are for them early on. And that's what part of the, what qualifies as a disability was something I realized maybe need to do a better job of explaining this. And so we are a lot more thoughtful with that in terms of how it's explained to students so that they can know that some of these things that they may not have previously thought of as a disability would potentially qualify.
That makes sense. So, quick turning the tables a little bit. I'm curious. We have a lot of folks who are pre-learners or learners and undergraduate. What made you decide to go to PA school versus APRN school or become a nurse or go to medical school? Like, what was the calculus for you when you were thinking about, because you had shared you had good grades, which is one, in my opinion, one of the qualifying factors of getting into medical school. Um, PA school is 2 years, medical school is 4, and then there's 3 years of, extra training, although there are residencies post-PA. We're trying to get one at ACH, as a matter of fact, you and I, our super secret evil plan. But, what, what was your calculus? Like, what were you thinking about? Because obviously, I'm assuming at some point you decided you wanted to help people, and you like science, and you wanted to be in the healthcare profession. What was your thinking, back in, 2014 or 2015 or so?
Absolutely. I have always been pretty one track minded that I was going to end up in the healthcare field in some way. I loved the thought of being a diagnostician and just the kind of detective work almost that you have to do in this role. And so I knew I was leaning more towards, a medical type training. And so went ahead and went to undergrad and got a biology degree, and continue to be fascinated by that. And so I did choose at that point, do I want to go to medical school? And um, that had been something that was a high consideration for a long time, mostly because PAs in Arkansas were still not super prevalent at the time. And so as I was kind of, making these decisions of what my next step was going to be, I was learning more about the PA profession, and realizing that it too follows this diagnostician career and has a very similar yet abbreviated training to medical school. And then one of the things that was really alluring to me about the PA profession is the collaborative practice model and being able to work in this team based model. I really was excited about that. I was also a little bit excited about the lateral mobility and different opportunities you can have that you don't have to focus in on one avenue of training and then commit to it for the long haul. You're trained as a generalist, as a PA, and can move within different disciplines with more continued training on the job. And so I think that was the thing that pushed me a little bit more toward the PA profession when I had to finally make that decision. But I knew I was going all in on medicine one way or the other.
So, then you graduated from PA school, and did you join the faculty right after graduation?
I did not. I started working clinically in plastic and reconstructive surgery here at UAMS and did that full time for about 3 years. I remember a moment sitting in one of my classes in the didactic phase during PA school thinking, I feel like I could do this someday. Growing up, even as a kid, I kind of went back and forth between teacher and, it was doctor at the time. And so I kind of feel like I got the best of both worlds now. But I started precepting and mentoring students just as soon as I could and came over and started helping with suture labs and lecturing when I could. And so when I had an opportunity to come over and teach full time, I had a hard time leaving clinical practice, and so I stayed on with them part time as well, and did both for up until just this past fall. So yeah, I definitely enjoy um, coaching others, teaching, and I love being in the academic setting and being able to train up PAs who the way I like to look at it is, I can have this much of a reach myself as a clinician. And then if I train PAs who go out and practice in a myriad of settings, then I get to reach patients on a even greater, more global scale.
Oh, I really like that. I mean, that's really a clear explanation and makes total sense. So, are you enjoying your job? Are you nervous? Because I think from what I heard you say is that you've stopped practicing clinically and you're full time in a teaching role outside of the clinical environment. And I'm curious, are you nervous about that, or does it feel good in terms of your life balance? Because I imagine you were working full time in academics, and then on top of it, you had clinical duties. And then I think you're a mom. Is that correct?
Yes.
So you've
Yeah.
got another job being a mom as well. So um, how do you balance that all with academics and all that?
Well, and that was part of the decision for now to step away from clinical practice, was trying to find the balance. I don't think there's any true thing as complete balance at any given point. I think you kind of lean one way and then have to um, lean back to try to balance yourself as best you can. It did get to be a lot for the season I was in, and we're in the middle of prepping for an accreditation site visit. And
Mm.
so things are all hands on deck here. So for the time being, but who knows what the future holds? There may be another season where I can start practicing clinically again. I do miss it. I mostly was first assistant in the OR, and so you can't just simulate that environment elsewhere. So I do like getting to teach the students the same skills that um, I'm not getting to actually perform with patients right now, though.
There is something, and I work with young learners. I just had a first year medical student working with me. There is something that is very stimulating and like intellectually stimulating about working with young learners because you have to kind of put yourself as someone that's been through school and you've now had 8 years of clinical experience to say, wow, at some point I didn't know that much, and you have to put your mind into the mindset of the early learner, and I've always found that to be, very stimulating. Now, if there are students listening to this podcast, which there will be, what advice do you have if a student is struggling wherever they are? They're in nursing school, PA school, medical school, OT school. They're just struggling with what they're dealing with, whether it's in the classroom or in the clinical setting. What advice would you give to students who are struggling with mental health issues?
I think first and foremost, I would say that you should not be trying to just navigate that solely on your own.
Mhm.
I know we have a culture in our program where we have a very open door policy, and we want our students to come to us anytime they are struggling. I know that some academic programs may not have as strong of a culture with that, and that may be more challenging. But there's always someone that you can reach out to talk about this. And if what you're doing is not working, then we need to try to reevaluate. And that's where asking the curious questions can really be helpful, instead of just repeating and trying the same thing. I think that was the thing that was most beneficial for this particular student, because she had not met with just me. There had been multiple meetings with other faculty prior to. And so it just takes the right person to listen to you and come with that open mind, with that um, place of humility to hear you. And so I think we all have to be our own advocate in a sense, and not, if someone's not hearing us, then continue to reach out and find that resource. I would encourage students to definitely reach out to their faculty first and try to get that support. If that is not working, then maybe it is, if, especially with mental health. Of course, going to your medical provider, going to a counselor. There's so many resources, and so nobody should ever have to struggle alone.
Yeah. You know, I think it was William Osler said, "Listen to the patient, they will tell you the diagnosis." And in some
Mhm.
ways, your um, story today is emblematic of what we're supposed to do with patients, to listen to them before we jump to conclusions. And listening to students who are struggling and really understanding where they're coming from is is the part of being a good educator, because we once learners in our program, our job is to do whatever we can within reason to make that student successful. Is that fair?
Oh yeah, absolutely. Y- I feel like the listening piece of it is just the most critical. A lot of us are, without even realizing it, I think subconsciously we may be walking around reacting to, stories we've already made up about other people or assumptions that have been made. But having just, yeah, going back to that place of humility to really hear what someone is saying and listen intently, I think is so critical. And it is a important skill as a provider. It's an important skill as an individual in your personal life. um, Instead of jumping into conversations, even with my husband, making assumptions, since that it's kind of impacted even that. And then even in the like offering of ideas and suggestions, instead of coming in with my agenda, asking questions to see what they think of, for what solutions do you have, kind of thing. My husband calls it mind manipulation, but I like to call it coaching. So I think that's a
That's
little
funny.
friendlier.
That's funny. Yeah, I've also said my own wisdom is from mentors has been that this is going to be great for a short. When we post a short, because we post some shorts from these videos, is that the essence of healthcare is bidirectional communication, listening intently to your patient, in this case, the student, which is not your patient, but to be an effective administrator and um, leader and teacher within the context of your program. It's listening well and then being able to articulate as a provider your thoughts and feelings. And because part of what we do is education, we're educating the students, we're educating uh, patients. And I always talk to my group that we focus on in the emergency department undifferentiated care. So we don't know what the patient usually has. Many times we do, but we don't often. And then we develop a differential diagnosis. So the different things that can be wrong with them. And then we make a diagnosis. And it's like, yes, the kid has otitis media, or the child has strep throat, or a broken this or broken that. But I would say that just right below making the diagnosis is education, and making sure that before they leave the emergency department, before they leave plastics clinic, as they walk out of the OR and they're heading back to their home, that they understand what the return instructions are, that they understand um, uh, what treatment plan we have for them. And I think that piece of it is sometimes we miss that, doing that well. And what's really interesting is that the Latin word for doctor is teacher, and so we're all teachers on some level. And you're teaching your students all the way, but I have a feeling that your interaction with that student is an incredibly beautiful story because that interaction led to the student becoming successful because you listened. So, um, what a great story for all of us who are educators and clinicians. And I learned this from one of my other podcast guests, and I like ending the show with this: is asking you a question. What did I not ask you? What did I not ask you today, or what did we not talk about that we should have said? We should have said something around this topic.
I think the only other thing I would add would be just kind of going back to, the mnemonic I had mentioned, the end of that. You made me think of this in some of your closing statements just now. The W in that grow mnemonic is way forward. And so
Mm,
that treatment plan or what even the coaching session for a student or a someone who reports to you in the clinical setting, um, instead of jumping straight to the prescription, which even as a clinician, obviously you're going to have a treatment plan, really thinking about the way forward. The best way to approach that is a partnership. And that comes from hearing what our patients have to say, hearing what the person you're coaching has to say, and them having some stake in what that way forward is and some buy-in to that. And so that transforms this authoritative prescription of here's what you're going to do and leaving the patient's room, and moves that more into a partnership, which then is going to create empowerment when the patient, the student, someone has had some buy-in in that way forward, what the plan is moving forward. So I think that's a critical piece of it that we have to make sure we're doing in those situations.
that's great. The UAMS PA school is incredibly lucky to have you. And just for the record, thanks to my partnership with Hillary and the program leadership, we brought on two recent PA graduates to work at the Arkansas Children's Emergency Department. And those two individuals are just working out phenomenally well. And I hope to continue having a partnership. And the super secret evil plan is to steal the best students to come work at Children's because uh, I personally think children are very special. You're a mom, and you know, sometimes in various PA programs and others, uh, there's less exposure to children that I would like during their training, and so getting students to come and work with us or wherever they are in the country to learn as best as they can how to take care of kids, I think is important. But this was an honor to have you. It was a really good discussion, and I appreciate the meaningful story you shared on human medicine, and would like to have you back at some point and talk more about what's going on at the PA school at UAMS.
Absolutely. Well, thank you so much for having me. And I just want to say too that, on the academic setting, we can't do what we do without clinicians who are willing to invest in
Mm,
students and precept in the clinical setting. So thank you for all that you do in that way too, and for
thank you.
everyone who gives back in an academic way.
Well, it's a team environment, as you said, and one of the things I like about emergency medicine is we're one big team. So
Absolutely.
with nurses, PAs, APRNs. So for those of you who are listening, please subscribe on YouTube, Spotify, Apple Podcasts, wherever you get your podcast information. This is Dr. David Spiro on another wonderful episode of Human Medicine, HUMED, and I hope you all have a great day.
Thanks for listening to HUMED with David Spiro, MD. If you like this episode, make sure you're subscribed on Spotify, Apple, or your favorite podcast platform. The video versions are also available on YouTube. Make sure you subscribe and hit the bell there so that you never miss a future episode.